How's it going, everyone? I'm Salzy, and today I'm going to be talking about why I chose to become a medical marijuana patient. This video will serve as a precursor to my actual use of cannabis. I hope that this gives adequate background about the type of chronic illness that led to me being approved for my medical card. For some context, I am an 18-year-old guy, and I live in a state that has legalized weed for medical and recreational uses. Anyone could be eligible for a medical card, meaning that minors, 18 to 20-year-olds, and 21-plus-year-olds can all apply for a medical card. If the patient is under 18 years old, it will be significantly more difficult to get a card, but it's not impossible. Obviously, if you are under 18, a parent has to supply the child with the weed, meaning a 10-year-old can't just walk into a dispensary. Once you're 18 and have a medical card, you can officially enter and purchase from a dispensary. I'm going to make another video explaining more about my medical card and using weed in another video. So, back onto the main story. I'm no stranger to chronic pain. I developed arthritis at the age of 7 and was officially diagnosed at age 8. It began in my hands and moved to my knees and feet. It was bilateral, meaning it happened on both sides of my body. At 7 years old, I would wake up with swollen hands and feet. I was a super active kid. I was always outside with my brother and friends. We would do the most stupid shit, but it entertained us for hours. Most days when I didn't have school, I would be outside from dawn till dusk. And even on school days, I would rush to finish my homework so I could go outside. As a kid, I did have access to video games, TV, and a computer, but I would much rather prefer going out and spending time with these two kids that lived, not really next to my house, but I could cut through the yard to see them, if that makes any sense. Well, once the arthritis hit, I wouldn't be out playing anymore. I would wake up with swollen and painful joints. Obviously, it was pretty painful for a 7-year-old to go through this. Looking back, that level of pain would be manageable for me now, but as a little kid, it was a really big deal. Most kids don't have a super high pain tolerance, and I was no exception. It took nearly a year to see a rheumatologist. Mostly in the beginning, I had a ton of x-rays and I was just taking over-the-counter meds to survive the day. Even after seeing a rheumatologist, I had a long way to go because obviously there isn't a one-size-fits-all treatment for arthritis. I was put on a bunch of medications, most notably prednisone, methotrexate, and Humira. These were some nasty meds, dude. I mean, prednisone made me gain a lot of weight, but it also caused some really extreme brain fog. The methotrexate helped a bit, but it also made me puke half the time I took it, and the Humira was just a bitch. I don't know if I was extra sensitive to the ingredients, but that shit was painful as hell to inject. I finally got on a medication that worked, and that was called Actemra. At the time I started this medication, patients under the age of 18 had to take this medication by infusion. So once a month I would go to the doctor, which was about 45 minutes away, and sit in the chair for 3 hours to get the infusion. That's honestly not that much time compared to other types of infusions, which could take all day to do. Anyway, this medication worked, and after maybe 2 or 3 years of infusions, my insurance decided they could pay for the injections instead of the infusions. So these days I inject the highest dose of Actemra I can get once every week. I could do this at home, which was really, really nice. When I initially started these infusions, I was so happy that something finally worked nearly 100%. But, ladies and gentlemen, the second this shit started working and I was pain-free, another medical problem came up. See, life just hadn't taken enough punches at me, so Jesus himself came down and smited me. I was 13 and in 8th grade. I don't remember the first day too well, but I remember I woke up and I was convinced someone had lit my leg on fire. I was in a lot of pain, which was concerning. This clearly wasn't joint pain like my arthritis. The pain felt sort of like muscle pain, but also my skin hurt. It was kind of a unique pain that will be hard to describe. This pain permeated the entirety of my lower leg. It was in my skin, my muscles, my bones. But this pain wasn't the only sensation. It kind of felt like there were bees under my skin. I felt this constant, intense buzzing. And when I looked at my leg, it was completely pink in the area of the pain. When the pain didn't go away, my mom was rightfully concerned, and for one reason or another, she sent me and my dad to the doctor. Now, usually my mom would accompany me to my appointments, but for some reason I can't remember, she didn't on this day. I go to my local emergency room. I was in a ton of pain, but at this point in my life, I could hide that pain pretty well. I mean, I was going on 7 years with the arthritis, so I was no stranger to pain. Now, this pain did hurt more than my arthritis, but I still knew how to put on a good face. Well, I get into an exam room, and a nurse asks me a few questions before the doctor sees me. I remember this moment very vividly. She asks me to rate my pain on a scale of 1 to 10. Now, I think 1 to 10 scales are bullshit because pain is so subjective. For me, this pain was one of the most painful pains. The only thing I could compare it to at the time was when I broke my arm. It's important to note that the pain would get worse from here, and today I would consider this hospital visit to be when my pain was at its lowest. So the lady asks me to rate my pain. Now, I don't want to go to a 10, obviously. I told her that my pain was at a 7, and she looked at me and in the most condescending voice said, "If you were at a 7, you wouldn't be able to walk." This bitch had the audacity to tell a 13-year-old that he was lying about being in pain. I just sat there dumbfounded like, is she for real? I am at the emergency room because my pain was so bad, and I was visibly uncomfortable. I was shaking and stammering and flushed, and this lady tells me to bring the number down? I really should have stood my ground. I mean, that shit hurts, but I've never been one to argue, so I say, okay, it's a 5. It was obviously more painful than the middle of the road, but I met this nurse halfway. Well, at this point, I can see her computer, and this bitch types in her notes that my pain was a fucking 4. I ain't gonna say anything, but I think this violated some sort of patient rights or something. Well, she finally leaves, and a few minutes later a doctor comes in. We go over all the typical questions in this scenario, and he does a physical exam. He was poking and prodding, and this hurts, man. After being in the ER for a while now, all this doctor has to say is there is nothing obviously wrong. He recommended physical therapy and wrote me a prescription for it, but as I've learned, it's hard to get adequate care when the doctors don't know what's wrong. I mean, like, what am I supposed to do? Go to the physical therapist and say, yo, my leg hurts for absolutely no reason. Can you just, like, throw whatever at it and hope it works? Obviously, I was not satisfied. I wanted a proper diagnosis, and at this point, I'm not even considering that this pain will be chronic. So I'm going about life as normal as I can, hoping I'll recover quickly. Less than a month later, I'm at the doctor for my regular infusions, which I was still on at the age of 13. I was wearing long pants, but at one point my mom, who was with me, asks one of the nurses about my leg. So the main nurse who ran the infusion room came over. I lifted my pant leg, and she was immediately concerned. At this point, my leg is bright red. She basically said, "That's not good," and called for another nurse who had been working at this hospital for a long time. She was a sweet nurse who had taken care of me before. She comes over and looks at my leg and said, "Yeah, that's not good." She took a pen specifically made for skin. It's like a pen that they would use in surgery to mark parts of the body. And this pen would stay on your skin for a long time, and the purpose of that is to make sure that this wasn't spreading. It didn't look like a rash or anything, but it was possible that it would spread, so it was kind of a safety measure. The two nurses say I should go to the ER right after the infusion. This is a different hospital than the one I went to previously, so maybe this ER would have some idea of what to do. This hospital that I go to for rheumatology had a pretty good reputation at the time, so I was hopeful. So after my infusion, my mom takes me to the emergency department of the hospital, and we are there for a good number of hours. When the nurses checked on me, they noted how bright my leg was. One nurse suggested that I wore red socks and the dye stuck to my skin, and obviously that wasn't true. I mean, I didn't even own red socks, let alone knee-high red socks. The doctor came in, and it was much the same as my previous ER visit. He didn't know what was happening, but was confident that it was nothing deadly. It might go away on its own, it might not. Either way, I was safe enough to go home. Well, finally, when I'm back for another rheumatologist appointment with my actual rheumatologist, I don't see the rheumatologist every time I get an infusion, which is why I didn't tell him prior to this appointment. We talk, and he does a physical exam, and by some miracle, he gives me a diagnosis. Now, I was skeptical about the diagnosis because it seemed too easy to get. Like in my experience, actual diagnoses take months, if not years, to get. He tells me this looks like complex regional pain syndrome. Apparently he has had multiple patients with this condition and I fit the criteria. Now, I wasn't about to go around telling people this is what I had because, like I said, this all seemed too fast and too easy for me to be comfortable claiming this is what I have for sure. I'm going to take a moment to tell you what CRPS is. I'm going to dumb this down not because I think you're dumb, but I think layman's terms make it more digestible. So, typically, CRPS is caused by an initial trauma. Things like car crashes, broken bones, fractures, heart attacks, surgery, that sort of thing. Normally, the body heals from these traumas, and the pain subsides as the affected area heals. In CRPS patients, they might physically heal just fine, but the pain signals kind of never shut off and go a little bit haywire. This is what causes the intense pain. Skin changes are also an indicator of the disease. Many patients get swelling, discoloration, temperature changes in the affected area, muscle spasms, changes in hair growth in the affected area, and so on. To the best of my knowledge, I did not have an injury that caused this. Sometimes CRPS can result from a more minor issue, and the patient may never know why they developed it. But since I didn't have any trauma to point to, I was even more skeptical of the diagnosis. However, when I was referred to my first pain management doctor, they agreed that it was CRPS. Then, when I met my second pain management doctor, they agreed with the diagnosis. And finally, when I met with my third and current pain management doctor, they agreed with the diagnosis. Sometime in between all of these visits, my CRPS actually spread to my other leg, and while my left leg is still my worst leg, the pain in my right is still excruciating. Over the past 4 to 5 years of having CRPS and seeing all of these doctors, I wasn't offered much treatment. I would go to as much physical therapy as my insurance allowed. At best, physical therapy made no difference. At worst, the physical therapy exacerbated my symptoms. I tried 3 medications and none helped, and some came with nasty side effects like brain fog or vision problems. I tried acupuncture, but that was an expensive endeavor and gave me no results. I've tried over-the-counter medications and vitamins, which did nothing. You get the idea. I've tried everything that has been offered to me. The reason why I've gone to 3 pain doctors is in part because many of my doctors during this process couldn't really help me. Last year, my pain got so bad that I had to admit myself into the hospital because the pain was unbearable. You learn pretty quickly that if you have CRPS, going to the hospital will essentially do nothing. My current pain management doctor could really only recommend the acupuncture and more physical therapy, and at this point she can't offer me anything else. At this point in my life, I can barely walk. I usually have to use a wheelchair or other assistive devices when outside of my home. The pain is so bad that I can't live my life normally. From keeping a job to going out with friends, everything is a challenge due to this pain. I've known that medical marijuana is a thing, and I knew that people use medical marijuana for this type of pain, but I thought it would be a long, hard process to get a medical card as a minor. Well, guess what, boys? I'm not a minor anymore. I consulted with my pain management doctor, and she left the decision up to me because she really had no power to get me a medical card. I ended up going through a third party who I've never dealt with before, which is a little sketchy, but at the time it was pretty appealing because it was such a quick process. I filled out a lot of forms. I had a quick meeting over Zoom with a doctor, and they gave me my medical card at the cost of $200. When I tell you it was easy to get this medical card, I mean it was stupid easy. I'm planning on making a video about that process because I think it can help people in a similar situation. I'm looking at the time right now, and I don't want this video to be too long, so I'm going to be making more videos about how I consume weed, what benefits I get from it, and how weed affects my quality of life. If you're interested in my point of view as a medical patient, I suggest subscribing and turning on notifications because I will have more videos very soon. Thank you so much for watching. I'll see you next time where I will discuss my medical cannabis experience so far.